Would you want to try it that way?
Mm-hmm.
Okay. And then what I'm going to do is have one hand here and lean forward a little bit. And stand up. That was better. Much better. Okay, now you can take your pants down. Okay, now we'll sit down again. Here, Lauren has difficulty sitting down because she is standing on a locked knee. To help her release her knee, I bring the pelvis slightly down and forward. So what we need to do, that's right. And lean forward now. Lean way forward and bring your hips back on the chair. That was good.
Yeah, see, that's better.
That was better, wasn't it? That was much better.
Bend.
That is, because what happens is your knee locks, and when you bend forward, then it can't go anywhere. So you have to loosen your leg a little bit when you do that. That was good.
Exactly.
That was really good. There are 3 ways to incorporate a non-functional upper extremity into activities of grooming and hygiene. You can place the involved arm in weight bearing or use it as a stabilizer. You can guide the hand, or you can have the patient do a task bilaterally with both hands together. During the following tasks, observe just how often these 3 methods are being used. When washing at the sink, position the patient in front of the sink and place their arm on the counter. It helps the trunk to be more symmetrical, and it also makes it easier for them to wash under their arm. Try incorporating the weak hand into the activity if at all possible. When shaving, patients can either sit in front of the sink or stand at the sink, depending on their level. Again, take their arm out of their lap and place it beside the sink. At least it's in a weight-bearing position here. It's also in his visual field, and he'll be more likely to use it as an assist. At times, I may incorporate that hand into the task. While shaving bilaterally, Dale is weight-bearing through both elbows. It's a nice way to include the weak hand into a part of the activity. As your patient improves, try having him stand at the sink while shaving. Okay. It's scary, isn't it? Yeah. It's real scary. Dale is very fearful of standing, but shaving in front of the sink provides a very safe environment. The sink is in front, the wheelchair is behind, and I'm on his weak side. Look how tall you are. You didn't know, huh? You're so used to looking now. Now I've got you. You're not going anywhere, and you can get this. I found that a patient's tolerance to standing improves dramatically when there is a reason to stand. If Dale were to stand in the physical therapy gym just for the sake of standing, his tolerance would be much less. But when he stands during shaving, something he did for years before his stroke, his endurance is much better. How someone brushes their teeth is very individual and can be very personal. Again, having their arm along the sink encourages them to use it whenever possible. Do you want to try brushing your hair a little bit? When Harriet brushes her hair, it makes sense for her to use her strong hand. But sometimes I guide her weak hand to just give a bit of sensory information to that side and, at the same time, work on some range of motion. Here are a few more tips to help your patients, whether they are washing at the sink or taking a shower. Sometimes it's hard for your patients to wash and dry the strong side. One of the things that I do is I just have you place it down on your leg there and get it flattened out. There you go. And you could put a little soap on it. Right. And not necessarily for your weak hand, but it's for your strong hand. So if you wanted to wash this part of your arm, for example, then you can reach down. Can you do that and just show how you, that's it, exactly like that. And the way that I suggest for people to dry their back off if your back was wet is I would take this and just shake it out, you know, like a, get it long.
Just hit
And
yourself.
you can hit yourself, or I just have you lay it up there and then reach behind and pull it down.
Oh, yeah. Like that.
That's right. And that gets one half of your back. Then you can do the same thing on the other side, Lauren. If you take the same thing and throw it over this shoulder, that's right. And then reach behind and pull it down. And that way you can get your entire back dried off that way. Adaptive equipment can be very helpful, but too much equipment can be confusing to your patients. Here are two very simple, inexpensive ideas that my patients have used. First, a brush with suction cups, which can be used as a fingernail brush, a denture brush, or can also be used in the kitchen to help wash utensils. And you could, right, exactly. Get your fingernails cleaned off that way. I get a special one of these just for dentures. And then what I tell people to do is to put the washcloth in the sink. And the reason I do is because sometimes those dentures slip right out of their hand and it'll chip their teeth. And that's expensive. That's really expensive. So I just tell people to put the washcloth here, and then they can clean their dentures right on the denture. And we use this only for dentures that way. Here I'm showing Dale how to make a soap on a rope. It sounds so simple, but many patients slip and fall at home reaching for that bar of soap that has fallen to the floor of the shower. It's cheap, it's easy, and my patients love it. Punch a hole in the middle of the soap. I like to use ivory because it doesn't crack. Cut a length of cord and push it through the hole. Here, you can hold that for me. I'll just tie a knot in it. Tie a knot and you're ready. Okay? Now, you can either hang that up, or you can have that when you bathe, exactly, and you put it over. And look how much easier that is. You can, exactly, that's right. You like that?
Yeah.
And then you can get this wet.
Yeah, I do.
And then you don't have to worry about it slipping. Exactly. Yep. And you can take it off if you want to. So you like that idea? So easy to do, but ivory soap works well. You like that? Yeah, good.
God.
These are just a few of the many ideas in self-care training that can help your patients to become more independent and, at the same time, make your treatment sessions much more therapeutic. And we'll go ahead and just